Hi everyone, this is Dr. Hall, and we're going to move on from the medial compartment of the thigh to the anterior compartment of the thigh. A quick review of what we've done thus far. We've got the adductor magnus, the gracilis muscle, adductor longus, pectineus muscle, and deep to the adductor longus, in there is the adductor brevis. This is just supporting things for me. We have the femoral artery and vein that are going to move through that adductor hiatus to become the popliteal artery and vein in the popliteal fossa. So the first structure that I want to add is actually a structure that we learned when we did the posterior abdominal wall. So I'm going to add two muscles in here. I'm going to move my vessels out of the way. So this would be the Psoas Major, and this is the iliacus. And so these two muscles, right, they come down and form a common tendon, which then attaches to the lesser trochanter of the femur. So when that shortens, right, that's going to flex the hip. And so we now call it the iliopsoas muscle. We just call it as a combined muscle. I can't get that to stay. And what you'll see is that the femoral artery and vein are coming across, and they kind of come in this space in between the iliopsoas and the pectineus. So it's always helpful in the cadaver to remember that the iliopsoas is lateral to the femoral vessels, and the pectineus forms the medial side of what we often refer to as the femoral triangle. You'll see why in a minute. We have another structure that's going to be coursing along with these femoral vessels, and that is the femoral nerve. So go ahead and craft a nerve. You'll remember that's coming out from behind the psoas major, part of the lumbar plexus, and it's going to come along here. The femoral nerve is going to supply all the muscles of the anterior compartment, which we haven't done yet, but we'll see those in a minute. And it's really important to remember that the order of these structures in the femoral triangle here is nerve, artery, vein. Sometimes in medicine we need to access the femoral artery, sometimes we need to access the femoral vein. So nerve, artery, vein, think navy, is a way to remember how those are organized. So now we're going to go ahead and add the structures of the anterior thigh. The first one is going to be, I'm actually going to put in the patellar tendon and ligament. So the patella would be within this tendon here, and then the four muscles that make up the quadriceps in the anterior compartment all attach to this same tendon. So this first one, which is going to run right along the femur and be in between some other muscles, is the vastus intermedius. Over here on the lateral surface, we're going to have, no surprise, the vastus lateralis. And then on this side, you guessed it, the vastus medialis. So these three muscles all attach on the femur and then down to this common quadriceps tendon. The fourth muscle, the rectus femoris, which is a long straight muscle, because rectus means straight, femoris because it's along the femur, basically runs on top of the vastus intermedius and then comes up and attaches to the anterior inferior iliac spine. So this muscle is unique among the quadriceps because this one actually doesn't just extend the knee by pulling on that patellar tendon. This muscle also helps to flex the thigh. So that is unique. So we're almost done here. We've got our four quadriceps muscles, rectus femoris, vastus lateralis, vastus medialis, and vastus intermedius. And we have one final muscle, which is the sartorius. It comes from Latin sartor for tailor. It attaches from the anterior superior iliac spine, comes down diagonally, and attaches on the medial proximal tibia, right near where the gracilis inserts. So what the sartorius muscle does is it flexes the the hip joint, but it also, because of where it attaches down here, it will externally rotate or laterally rotate, as well as flex the hip, as well as flex the knee. So this muscle is very active when you kind of move your leg into that crisscross applesauce cross-legged position, which is how tailors used to sit, hence the name. Sartorius is also the longest muscle in the human body, so that's kind of an interesting factoid. So let's dissect down and do a review. We have our Sartorius muscle, long strappy muscle for crisscross applesauce. We have our Rectus femoris attached to the patellar tendon down to the patellar ligament to the tibial tuberosity. Vastus lateralis, vastus intermedius, and vastus medialis, none of which cross the hip joint, so they are just extensors of the knee. And we have our femoral nerve, artery, and vein, with the iliopsoas muscle making up the lateral portion of the floor of this region and the pectineus muscle making up the medial portion of the floor of that femoral triangle, as it is called. Quick review of our medial compartment of the thigh. So pectineus, adductor longus, right there. Deep artery of the thigh, adductor brevis, and adductor magnus, and gracilis, which should be attached to the pubic bone there. All right, and that's it for anterior and medial thigh.